Genevieve says, hey again, Raf, hope you had a good week. I did. I had an awesome week. Thank you very much. Just a small niggly question on the rectus femoris, which is the straight muscle of the femur. It's the central muscle in the front of your thigh, one of the quadriceps. From the anatomy of the knee lecture, what I understand is that in standing, hip flexion, then knee extension. So in other words, when you stand up, you lift your leg up and then you straighten your knee. So your leg is straight out in front of you. This movement, it shortens the rectus femoris across the hip and the knee joint, because the rectus femoris is a hip flexor, so it flexes the hip, and it's a knee extensor. It's one of the quadriceps, so it extends the knee and flexes the hip. That's correct. Thus, the burning and difficulty of this position and the muscle pulling from either end. Is that right? 100% spot on. You've got it, Genevieve. So when we see yogis or dancers standing and lifting one leg straight up in the air with the knee straight, is this something that can be progressively worked on, even though it is always going to be shortened across the two joints, or are some people just genetically able? Thank you, Genevieve. Genevieve, so I think it's a little bit of both. So the ability to lift the leg up involves working the rectus femoris at very short muscle lengths. And there are also other hip flexors that are working there. So the psoas, the iliacus, the tensor fasciae latae, the sartorius, the pectineus, adductor brevis, adductor longus, they're all going to be working in that hip flexion movement. So even though the rectus femoris, is working really hard at a very short length and thus probably not producing a lot of force, the other muscles can compensate and make up for the difference. So, having a stronger psoas and a stronger, all the rest of those ones can, make up for the lack of strength that the rectus femoris can produce in that position. So, and how do you get a stronger psoas and a stronger adductor brevis and whatever? Well, you practice movements that strengthen the psoas and the adductor brevis. What's a movement? Well, a movement like standing, lifting a leg straight up forwards, where the rectus femoris can't contribute because it's maximally shortened and can't produce a lot of force in that position, will force the psoas and the pectineus and the iliacus and the blah, 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 all the other ones, to work harder, which will in turn strengthen them. So in other words, just practice doing the thing and you'll get better at doing the thing. So that's part of it. So yes, it's called a length-tension relationship. And as muscles are very short or very long, they produce less tension, whereas in their mid-range, muscles are much stronger. The other thing is that as you lift the leg up, you're lifting against not just the weight of the leg, but you're also lifting against the resistance of the muscles and tissues on the back of the leg. So your hamstrings, the fascia, tendons, etc. at the back of the leg have to elongate, and if they're stiff, and by stiff I mean a very specific thing. I mean resistant to length change. So when you pull on it, it is hard to lengthen it. You have to apply a lot of force to lengthen it. Well, if things require more force to lengthen, well, you have to apply more force to lift your leg up, right? So actually you want less stiff muscles, fascia, tendons, etc. on the back of the leg, and stronger muscles on the front of the leg, but particularly stronger at short muscle lengths. So the final two things I'm going to leave you with are, how do you make muscles less stiff? I'm not aware that there is a way. So I'm just going to leave that there. How do you make muscles stronger at short muscle lengths? Well, strength is joint angle specific. So when you practice strengthening at short muscle lengths, you get preferentially stronger at short muscle lengths. So doing like general hip flexor strengthening won't be anywhere near as good for this particular application as strengthening in the exact position that you want to get better in. So it comes back to get better at doing the thing, do the thing. And then probably choose the right parents and have, low stiffness in your passive tissues on the back of the hip. Hope that helped, Genevieve.